right hemispheric stroke, and he stopped painting for a while, but again encouraged by his wife, he started painting. And this is a portrait of his wife that he painted. See, the right side, now you look at it, this is your left side, this is your right side. That's how the artist is sitting in front of the canvas and doing it. So if I have got left hemifacial neglect, it will be this side. So this person has a left hemiparesis. So he was painting with his right hand, but he could paint the right side of the face quite well, but the left side painted very badly. This is because of left hemifacial neglect. Also, this figure drawn here is missing from this side, so he is neglecting it totally. So this is hemifacial neglect following a stroke. I have studied only one. Now there is another case. This is another case, very interesting. And this is a patient described by Lidko. Is a 40-year-old man who sustained a subarachnoid hemorrhage. An angiography showed that he had got bilateral middle cerebral artery aneurysms. One of them was clipped later. When he recovered from the subarachnoid hemorrhage and all that, he has never painted in his life. He suddenly started painting. And he painted some beautiful pictures. But this had an interesting thing. Look at there, he has painted a woman. He has put the breast on the right side, but forgot to put the breast on the left side. Also, there is the left arm there. I'm sorry, the right arm there, but the left arm is missing. So he has developed left hemifacial neglect. Look at this face, this side done beautifully. This side, the left side, is very poorly done. Again, left visuospatial neglect. Then he develops split cognition. He's painting one side red and one side blue. Nowadays it has become a fashion by artists to paint one side one color, the other side one color. They haven't got split cognition. They do it intentionally. But this man did it because of his neurological illness. But these improved. And later he made this sculpture, and you can see that the left half of the sculpture is quite beautifully done. Now what this case shows? Number one, it shows that he had bilateral middle cerebral artery aneurysm. So he had got bilateral cerebral dysfunction. And his artistic creativity was affected in two ways. Number one, he had de novo development of artistic creativity, but he had bilateral cerebral dysfunction. So far, what we have discussed with de novo development of artistic creativity, they are all with the left hemispheric disease. This man has got bihemispheric disease, suggesting that both cerebral hemispheres are necessary for artistic creativity or any creativity work. Secondly, he must have sustained a significant right hemispheric damage which resulted in the left visuospatial neglect, which is manifested in his paintings. Okay? So this case is very interesting, and it shows two things because the patient has bilateral middle cerebral artery. I have studied only one painter who had only one artist, I would say, who had a left hemisphere, from which he recovered quite well. He's in Guwahati. And I flew to Guwahati to see his work. And he could paint quite well, and there was no evidence of it. But what I found was something very interesting. Again in 2009, it came out in the paper, this picture in Telegraph. And it was reported that the Archaeological Survey of India have unearthed this sculpture, or the head of a sculpture, it's not the whole, it's the head of a sculpture, from somewhere in North Bengal area, Malda probably, which they could date it back to the Pal dynasty in 880. And they published it as one-eyed monster, because you can see that this sculpture has got quite a nice left eye, quite nice carvings on the left side of the head and the lower face. But where is the eye on the right side? Very primitive, and the carvings are absent. With some difficulty, I approached the archaeological department, went to their office, with a great detail about that, so that's different. I had to climb 7 stories without any light, it was load shedding. And then I had a look at that, holding in my hand. And it immediately struck me, and it did struck me before, that's why I went, that this person has the right hemispecial mental. That's why the right side of the sculpture is so badly done. So the artist, whoever has done it in 800 AD, that is more than 1,000 years back, so most likely actually had a right visuospatial mental. So this is published in Neurology India. I come to the last topic, and that may be rather controversial. Some of you might be conversant with this sculpture. This is a replica which I have got. This is the orthonarisha. The left half of the sculpture is male, the right half of the sculpture is female, mainly characterized by the presence of the breast on the right side and absence of the breast on the left side. But the sculpture is basically very feminine. As you can see the sculpture in Elephanta Caves near Mumbai, or you can find it in the down south, made of bronze, made during the Chola dynasty. But you can find it in many places all over the country, Ardhanarishwar temples. It is believed that the left side of the sculpture, that is the male sculpture, is of Shiva, and the right side, the female sculpture, is the female consort of Shiva, that is Parvati. And the two are unified together, perhaps suggesting the unitary concept of God. Whether it is God or goddess, they're all the same. I did some research 2-3 years back on the religious philosophy. There is a lot of physical scientific principles involved in that sculpture. Anybody interested can look up my article in the bulletin of the Institute of Culture or read Fields of Capra's book, The Tao of Physics, and on the possible neuroscience. I will concentrate only on the neuroscience. I liken the left half of the sculpture with the left hemisphere and the right half of the sculpture with the right hemisphere. What are the functions mainly of the left hemisphere? Language, motor control of skills, categorical processing, and calculations. All very male characteristics. And in fact, the literature says that the left brain is the male brain. The right brain, on the other hand, the right half of the brain, the right hemisphere, is concerned with spatial cognition, spatial imagery, artistic and musical talent, face object recognition, etc. All very feminine characteristics. And in the literature, the left brain, the right brain is often referred to as the female brain. And what we see in the sculpture, the left half is male, Shiva, the right half is female, Parvati. So, and the two are united, which means as the two halves of the brain are united together by the corpus callosum. And all creative works, I am repeating it again, needs the harmonious functioning of both hemispheres. It cannot be done with one hemisphere. People have done callosotomies and all that, and have shown that there is deterioration in creativity, even in artists. But there may be another explanation. I have found out from historical literature that the first sculpture was probably made between 35 to 60 AD at the time of the Kushana dynasty in north-central India, in the region of Mathura. It's done in a stone, but nobody probably has seen that, but it is mentioned in historical literature. Now the Kushanas were, those early Kushanas, they were Buddhists. So it's highly unlikely that they would sponsor a Hindu god to be built. Also, the sculpture was probably done by a village artisan who is unlikely to have knowledge of this religious philosophical knowledge that this is Shiva, this is Parvati, etc., unification of them, all sorts of things. What I thought that most likely is that this person, artisan, wanted to make a very beautiful female sculpture. But something went wrong for which he forgot to put the breast on the left side. And what went wrong? Compare this with this picture which I had shown you earlier. Litgos patient with left hemispatial neglect, missing the breast. Compare this with this. Don't you see the similarity? So my contention was that the person who did the first orthognathic sculpture must have been suffering from a left visual hemispatial neglect, for which he forgot to put the sculpture. But the fact of the matter is, we do not know, this is all guesswork, but details have been written and discussions made on that. That when you go to this Elephanta Cave, or you go to a South Indian museum and stand in front of this beautiful feminine sculpture of Ardhanarishta, do you really think about these gods and goddesses, or what Fritz of Capra wrote in his book, or these neuroscientific principles I am talking about? You are simply swept by the beauty of this sculpture, because as this professor of neurology wrote some years back, perhaps one of the reasons that Freud claimed reverence for beauty as a required trait of civilization was because beauty elevates human subjectivity and human values to a transcendent level. The sense of beauty in its reparative and perseverative function asserts love over aggression, life over death, and harmony over discipline. But don't think beauty is an abstract thing. It is said that beauty lies in the eyes of the beholder. I don't believe in that. I believe that beauty lies in the brain of the beholder, because current studies in functional neuroimaging has shown that an aesthetic appreciation, when you look at a sculpture or a painting and you appreciate it, the aesthetic appreciation, you get activity in the ventromedial prefrontal lobe, the cortex nucleus, the anterior cingulate cortex. When you aesthetic preference, you like this painting compared to this painting. This preference, you like abstract things and I don't like abstract things. I like realistic things. This distinction will be done by the ventromedial prefrontal. But when you are called into an art exhibition and asked to give markings, 5 out of 10, 7 out of 10, 8 out of 10, it is your dorsolateral prefrontal lobe that is concerned with rating of the beauty of art. You rate it by the dorsolateral prefrontal. These are all published work and done by functional neuroimaging. Last slide. The earth and the sun. And the moon, sorry. The earth and the moon. The reason for showing this is, and giving this talk is, many of you have built your houses. But if you want to see how beautiful your house looks, what do? Do you stay at home? Or do you go outside in the street and look at the house? If you want to see how beautiful our art looks, you can't roam about in the streets of Calcutta. You have to go up to the sky like an astronaut and look at the art from a distance, and then you can see how beautiful it looks. So if you want to see how beautiful neuroscience is, or clinical neurology is, you have to go outside neurology and then look at neurology. That's exactly what I've tried to do. Thank you.